Hey everyone, I'm just here to share a couple of misconceptions that I've been made aware of with people in the community, I guess, about the physical therapy profession in general. The first case, I had a new patient call and schedule an initial evaluation with me late last week. They were going to be coming in for an evaluation today, and they called yesterday to cancel that evaluation. And of course, my first question was, why would you like to cancel? Is it a scheduling issue or trouble getting here? We can move different days. And they said, well, actually, I think I need to cancel because we saw a massage therapist over the weekend and I'm just really, really sore right now. I'm in too much pain to come to physical therapy. And so I tried to kind of educate them as well. My goal as a PT is to assess dysfunction in your mobility and get you moving more normally in as little pain and as possible, as quickly as possible. So usually that's the best time. That's the time when most people tend to come see me, is when they're not feeling well, so we can get them moving better. So that was one misconception. And the other one I've noticed is, I've seen it on social media a lot lately, and even just, small talk, people talking to other people about, hey, I've got this pain. What's the best exercise to do for it? Or who else has this problem and what do you do for it? And how long does it take to get better? And so, I think there's power in surveying people with similar issues. But what struck me the most was that hardly anyone mentions using physical therapy to help improve these orthopedic problems. And I'm just kind of like, that's strange, because we're doctors, we're clinical doctors, and we're experts in human movement science. And so that's kind of our role in the healthcare industry, is to get people moving quickly, more normally, and with no pain, so that they can avoid surgery, injections, expensive imaging, medications, and all that stuff. So I guess I just want to encourage everybody to consider physical therapists as the first line of defense when you have an injury, an ache, or a pain. It's going to cost you way less in the long run if you come to see one, at least for an initial evaluation. And we are trained clinically to do differential diagnosis to see if this is really a musculoskeletal problem versus, a medical emergency to where you really may need to go get an image. And we will tell you that. So as far as cost effectiveness and getting you better quicker, there's very rarely an incidence where you need to go get expensive imaging before you come see a PT to really see what's wrong. Of course, unless you have an obvious fracture or something like that. But just want to encourage everybody to think about physical therapy for a first line of action for your mobility issues. So have a great Tuesday. Thanks.